Welcome to a special edition of Community Chat. This will be the candidates' discussions that we will be holding for the 2022 election coming up at the end of April 30th, if I'm correct. And the set of candidates that we will be discussing the questions or some of the issues with will be for Board of Health. Joining us today is a gentleman who is seeking re-election to the Abington Board of Health. He is Aaron Christian. Aaron, welcome to the program.
Kevin, thank you for having me.
I'm sure that most folks know who you are, but for the folks who do not, for the voters, tell us a little bit about yourself.
So my name is Aaron Christian. I am the current chair of the Board of Health. I've been serving since 2019. I initially ran for the Board of Health because I was most concerned about emergency preparedness, and I recently got involved with scouting in emergency preparedness, and I wanted to bring some of that community aspect to the board. Obviously, over the past few years, that's changed, and I want to continue on that mission of bringing the community back to the board.
What motivated you to seek re-election to the Board of Health?
Well, I feel it's very important now that we are beginning to transition into a post-COVID world, and we're not quite there yet. But as we go there, we're going to need people that understand exactly how the Board of Health operated prior to that. And currently, I'm the only member of this board that does. And I want to bring that historical knowledge back to the board so that as we begin to navigate post-pandemic, there's somebody there that can help lead that.
In your opinion, what would you say is the primary function of the Board of Health?
The primary function of the Board of Health is to create and enforce local health regulations. And really we have our mission, which is to promote, preserve, and protect the health and well-being of all Abington residents. So our goal is to do that, and our function is to create the regulations so that we can meet that mission.
The next one is somewhat similar, but I think you'll be a little bit more in depth here, and that is, how do you define public health?
Public health is, I don't know if I can define it, let's say, in just a couple of words. In reality, public health is about the community. It's keeping the community safe. And public health can be defined by a number of different things. We see it so much right now just on the pandemic aspect of things, but there's a lot that goes into it. And there's waste regulations, there's tobacco, there's so many different types of things that we get involved with. Really, at its core, it's keeping the community safe.
Okay. If reelected, what do you feel that you would most contribute to this board?
Like I mentioned before, the biggest contribution I hope to provide is that historical knowledge of how the board operates, and I want to maintain that level of efficiency that we've had throughout the pandemic as we move into this new era. And it's going to be a challenge because a lot of our new board members and our new staff are also going to be learning. And I hope to provide that as somebody that has experienced how our board has operated.
Okay. As we attempt to navigate life post-COVID, we cannot ignore that the pandemic did bring to light a few hot-button topics. How would you feel that you'll handle internal and external conflict if placed in that situation, if reelected?
Sure. Well, I think that the one thing that has been a challenge is that individuals come to our board meetings and really want to express their opinions, and I 100% encourage them to come and take part in every single discussion that we have. But there is a line, and we need to maintain an order when we're conducting our business. So when we run into those conflicts and we run into those things, my job as chair has always been to try and maintain a level of calmness in the room and make sure that we can operate and finish our business. And I'm going to maintain that same exact idea throughout my future term on the board, hypothetically here. I want to make sure that we can get our business done, and we can do it in as calm and as civil a manner as possible. Excuse me.
There is a potential that if you're elected and while you're serving on the health board, that the trash contract will be up for renewal. Now, while the contract doesn't fall under the board's purview, as a board member, what kind of regulations would you like to see proposed when it comes to reducing trash tonnage?
I think there's a couple of things we can do in terms of trash tonnage. The first things first is we need to hire a recycling compliance, education compliance resource officer. RICO is the terminology. Somebody needs to be out there enforcing the regulations that are already in place. And right now, we don't have the staff allocated to that. That's, I think, the first step in reducing that tonnage is actually going out and enforcing those regulations. The second thing is at our compost site or at another site, but starting to open up the acceptance of whether it be cardboard. We've talked about accepting cardboard at the compost site, some more prohibited and bulk items, anything that we can offer to take those out of the trash stream. And another part of that is also education. I mean, we talk about we want to educate the public in public health. And as far as recycling is concerned, education is going to probably be one of the biggest defenders against trash tonnage increases, teaching people how to recycle properly and how to throw away properly and, maybe how do you compost properly? There's a lot of things that I think we can do that fall into those categories, but those are probably our three primary objectives.
If you are successful come April 30th, what sort of proactive community health initiatives would you like to see promoted or geared towards the betterment of the town?
Well, I think right now I want to see us continue to focus on vaccination of all members of the community. That's going to be very important just to get us out of the pandemic because that's the primary thing that we're focused on. After that, I think trash tonnage, and I mentioned that with Rick Collins and Abington News. Trash tonnage is, I think, our next thing that we want to battle. And if we want to decrease that and decrease the waste-related nuisances we have to respond to and such, then we need to focus on finding ways to decrease that tonnage. So whatever initiative that may come across our plate to make that happen will be a priority as well.
So as we kind of rounding the corner to wrap up our conversation here, is there a question or an issue that we haven't talked about as of yet, but you want to make sure that you mention for the folks who are watching at home?
I will say this, the Board of Health is a regulatory body, and there's limited things that we can do. We don't have a lot of scope in terms of initiatives and things that we can do. But as a team, as long as we can work together, then we're going to be able to do a lot. And the sooner that our board can learn to do that, then we are going to be very successful. And that's something that I hope that I will continue to do, that I can bring to the board, and that we can all just learn to work together and be a great team for Abington.
Last question I'll ask you. If folks wanted to find out more about you, your campaign, how can they get more information?
They'll be able to do that at my Facebook page, which is Aaron Christian, Abington Board of Health. That's where all the information is, and if anybody wants to get involved and help out with sign holdings, things like that, but that's where you can find any updates. And I try to post all the Board of Health meetings as well, any of the agendas if I have them in time to post, things like that.
Excellent. Well, we want to thank you very much for joining us here today.
Thank you for having me, Kevin.
And we want to thank you for joining us at home and tuning in as we do our best to try to introduce you to the candidates and ask them basically where they stand on a lot of the issues. You're going to notice that with the candidates, the questions are going to be similar. That's by design to make sure that everybody's being asked the same question and given an afforded amount of time to be able to answer those questions. Until our next discussion, have a great day.